Hello, my name is Bailey. I'm here with Lindsay and Andrew, and we're presenting on left CVAs. What is a left CVA? A CVA results from an interruption of blood flow to the brain from a blocked or ruptured vessel on the left side of the brain. The site and extent of the affected area determines the loss of function. There are two main types, ischemic and hemorrhagic. Ischemic is the most common, around 85% of CVA cases. It's caused by damage to the region of the brain that is supplied by the blood vessels being obstructed. It can occur due to atherosclerotic diseases within the blood vessels. This disease is a hardening and narrowing of blood vessels due to the buildup of cholesterol. Hemorrhagic is the less common of the two, 15 to 20% of all cases. This can occur due to the ruptured brain aneurysm. This is a building area in the wall of an artery in the brain that is damaged, causing a leak or complete burst. This could lead to death or infarction of brain tissue. For a left-sided stroke, the middle cerebral artery can impact a lot of the symptoms that we will see on the next slide, which we all know that the brain is contralateral, so the left side CVA will impact the right side of the body. The most common symptoms of a left CVA are as follows. It can result in a loss of voluntary movement and coordination on the right side of the face, trunk, and extremities. Impaired sensations, including temperature discrimination, pain, and proprioception on the right side. Language deficits called aphasia, in which patients may be unable to speak, understand speech, writing, or gestures. Might present with problems with articulation of speech because of the disturbance in muscle control of the lips, mouth, tongue, and vocal cords. Blind spots in the visual field, usually on the right side. Memory deficits of past or recent events may occur. These are just to name a few. Each patient experiences a CVA differently. Some long-term effects of left CVA could result in a lot of the symptoms that's previously discussed. Hemiplegia, paralysis, or hemiparesis, weakness on the right side of the body, decreased sensation on the right side as well, speech and language difficulties, as we talked about aphasia, vision difficulties, cognitive impairments, executive function difficulties resulting from the damage of left frontal, temporal, and parietal lobes. The larger the CVA, the more cognitive impairments a client may present with. Clients are slow with their performance. They're aware of their deficits that they have after their CVA, so they understand what they can and can't do. They may also present with long-term effects of anxiety and depression. Again, no CVA is the same. Lindsay will now discuss assessments for a left CVA.
Assessments for left CVA.
The Fugel-Meyer assessment of motor function is a standardized assessment which evaluates motor function, sensation, balance, joint range of motion, and joint pain for clients post-stroke. This assessment will help to measure the client's recovery and then develop an appropriate plan for intervention. The assessment of motor and process skills, the AMPS, is an observational assessment that measures the performance quality of tasks related to ADLs in a natural environment. It is designed to examine the relationship between the person, the ADL task, and the environment. We would choose this assessment because it would help to identify the specific difficulties of the client during the task execution. The Berg Balance Scale is a widely used standardized assessment to determine a client's ability to balance. The functional design of this assessment allows for OTs to observe and score skills that clients use for mobility in everyday lives. Although this assessment typically takes around 20 minutes to administer, it'll likely take longer for clients with a CVA. We would choose this assessment to help identify balance impairments and then develop strategies to improve their stability and safety during their activities. The Stroke Impact Scale is a self-reported questionnaire that measures the impact of stroke on physical, emotional, and social aspects of health and function. It aids OTs in understanding the broader implications of stroke and designing the holistic interventions. This assessment ultimately allows for collaboration in goal setting, where both the client and the therapist can identify strengths, weaknesses, and priorities.
Treatments for left CVA. Motor functional skills training is a great treatment idea for left CVAs. To appropriately work on these skills, utilizing a task oriented approach may prove successful. You want to make each task meaningful to the client based on what their goals are. For example, if somebody were to enjoy cooking, you could start very simple early on in the process and have them make a peanut butter and jelly sandwich. That would be something meaningful to them since that is something that they're wanting to do, and it's something that will not be too challenging, and you can also grade it. It may also be smart to use constraint induced movement therapy, depending on the client, to utilize the affected side to improve neuroplasticity and motor recovery. This does not apply to every client. This is going to be a case by case basis. When looking at a cognitive rehabilitation, utilizing cognitive behavioral therapy may be effective for clients with left CVA. This is going to address the client's memory deficits and as well as executive functioning problems and problem-solving skills. A good example of this is if you were to run into a client that is very pessimistic or negative, saying, I will never recover, I will never do this, I will never do that again. If you run into a client that is like that, you want to address why are they having those negative thoughts? What negative thoughts are they actually having? And what can we do as OTs to change those thoughts to make them a bit more optimistic about what's going on around them? For visual rehabilitation, you want to work on strategies to compensate for that right-sided neglect that they more than likely will have. This is going to include scanning the environment and being aware of that visual field cut and or neglect. A good example of this is getting a food pantry, filling it up with different cans, plates, whatever it may be, and then having that client to find an item that is in that pantry by scanning the entire thing. Speech and language therapy are also going to be important aspects that you need to treat as an OT. One of the important factors is aphasia management. You want to encourage the client to give verbal feedback throughout the entire session, even if they aren't giving things that might be understandable. You want to have them do some type of communication with you, verbal communication, so they can hopefully get that ability to talk as high as they can possibly get it. You also want to work with the SLP on potential strategies to improve their speech. This is going to be a case by case basis. Not everybody's going to be the same. Swallowing therapy for dysphagia is also going to be an important aspect while we are helping them eat. This is, again, another thing that you're going to want to work on with SLPs to strengthen the muscles that they need for swallowing. This is, again, going to be a case by case basis. But a good example of this is encouraging hard swallowing to increase that efficiency of the muscle, making it stronger, so they can eventually get back to normal. And then you also want to try to incorporate the use of augmentative and alternative communication devices, or AAC devices. This could include picture communication systems, eye tracking devices such as that Head Mouse Nano that we've seen recently, and of course text to speech apps, just providing them a variety of different options to communicate with others if they are currently unable. As for all treatments, incorporating activities of daily living in each one is extremely important. With each task that the client performs, you are wanting to educate them on self-management strategies and ways that they are going to be able to perform that activity. Of course, as you are going through, all treatments should be purposeful and meaningful to the client and they should matter to them. But even though essential ADLs such as brushing your teeth, bathing, all those kinds of things are important, we want to also consider the hobbies that they have as well. For example, if somebody is really into gardening, what kinds of activities can you provide them to improve upon that activity so they can get back to doing that as much as they want to, right? For example, whenever you are using, I don't know, a shovel to dig up the dirt, what activities can you do to help them be able to dig up that dirt independently again? This may involve using adaptive equipment. So if that is the case and you need to teach them some new adaptive equipment, you obviously want to educate them on how to safely utilize it and how to properly utilize that equipment in an efficient manner.
Thank you for watching our presentation. Here are our references.